There is absolutely no business for a doctor to be at a normal birth. As a matter of fact, everything about being a doctor is against normal birth. They have stolen birth from birthing women and put it under their control, and they are making it more and more a medical procedure, which it is not. Birth is part of the normal life cycle. Birth was put into the hospital for no good scientific reason, and it should not be in the hospital. This 80 to 90% of women do not need to go to the hospital to have a child. It can be in an out-of-hospital birth center, or it can be at home. Home birth is absolutely safe, and there is a mass of excellent scientific research that proves that for the 80 to 90% of women who have no medical problems, home birth, planned home birth, is a perfectly safe, rational option. You know, the obstetrician is trained as a surgeon. He's a surgeon. He or she is a surgeon. What do surgeons do? They cut. And so, of course, they want to cut. So they're going to cut more and more. And if they cut more, they get more money, they get more prestige. The hospital gets more money, the hospital gets more prestige. And this is why there is this huge gap between what we know should be done and what is going on. First of all, they change her from being a human to being a patient. They take off all of her clothes, which is not necessary. They put her in bed. She doesn't need to be in bed. But they put her in bed. They treat her like she's sick. And they treat her as a patient. This all needs to stop, because every one of these interventions carries a risk. Epidurals for pain. Women die from epidurals. You know, they don't tell a woman that when she's in the hospital. Do they tell her the real facts about epidural? That she might die? They never say that. She might have a grand mal epileptic seizure? They don't tell her that.